morning, everybody. Welcome to your remaining session of this Health Literacy Symposium. So glad you're here and can join us this afternoon. Excellent. Well, I hear a couple voices trickling in out in the hallway. For the sake of time, I'll at least introduce myself. I'm Bree Ketterer. It's so nice to see all of you today. I am a hospice and palliative medicine physician here at OHSU, and I also have a special interest in serious illness communication, which has a lovely overlap with a lot of our health literacy work that you all have been learning about today. And throughout the course of my presentation today, I'm going to have a couple of colleagues come join me, and they sit in the front row, and you'll get to see them as the course of this presentation goes on. We'll have Marissa, Noemi, and Murph join us as well. So, you all have spent your entire afternoon hanging out with us today at the Health Literacy Symposium, and you've learned a lot of information. And now we're going to take a slightly different spin on this. And now we're going to give you some tools to take this information back to your colleagues, to your institutions, give them feedback so that you can then implement all of the changes and the great work that you've learned about today. So when we don't always get it right, we gotta give feedback so we can improve. All right, so the objectives for this hour are, first, we're gonna identify the importance of providing feedback to colleagues and institutions to enhance the clarity, accessibility, and effectiveness of content and materials. We're gonna describe the ADAPT framework as a structured approach for delivering feedback. And then we are going to have you all demonstrate the application of the ADAPT framework by providing feedback aimed to improve health literacy across our institutions' clinical, research, and education missions. So, you all came here today with a growth mindset. You wanted to learn, to grow, and to expand your skills. That's why you showed up. That's why you're here, right? Yeah, a bunch of head nods around the room. Right. And throughout the Health Literacy Symposium, you learned a lot of tools to help you and your teams do better, right? To get it right, to do the best that we can for our patients, our colleagues, our clients, our members, right? And through that, we are building this culture of change for a more health literate organization, and we're empowering one another to do better. And in order to do better, we have to talk about that hard stuff, which is when we don't quite hit the mark, right? And that's feedback, right? So despite our best efforts, sometimes we don't hit the nail on the head, or I put my foot in my mouth, right? And that's not bad or wrong, right? Because we want to do better and we want to grow. And feedback is key to that. So a culture where feedback on our work and actions is not confrontational, and rather it's conversational. It's working and getting us better. Right? And so that's what we're going to do today. Okay. We are going to talk about a way to take your skills from this Health Literacy Symposium, bring it back to your workplace, kindly, compassionately, and collaboratively give feedback so that we can have a more health literate organization. So first, we're gonna take a little step back. Why does this matter? Right. Turn to your colleague next to you. I want us to just take 30 seconds. What brought you here? Why are you here? Why does this work matter? going to pull us back. 30 seconds is quick. Who's willing to shout out why this matters, what brought you here? Patient and family experiences, right? They matter. What else? Improved access. Beautiful. Take one more. Public health and communication. I heard them at the same time. Awesome, right? So organizational health literacy is helping us with all of those things, right? It's helping us improve health outcomes, reducing our healthcare costs, and resulting in greater health equity. Right? And throughout today, you've learned about all of these more tangible ways in which we enact this, the way we do this. I'm gonna boil it down into like a couple big principles, these big buckets, right? Because you've learned a lot, right? And these will be kind of buckets that help us think about, gosh, when I'm going to give feedback, what am I gonna give feedback on, right? So it could be clear communication, right? Did we utilize plain language? Did we avoid jargon? Was it culturally appropriate? Our next bucket, were the resources accessible? Right? Were there a variety of formats, both visual, oral, and written? And was it available in diverse languages to whatever our individuals' needs are? Right? And is it patient-centered? Right? Did we have shared decision-making aids? Did we engage in active listening? And was it compassionately and culturally responsive? Right? A couple big buckets for us to think about. So, I know feedback can sometimes be a four-letter word. And a experience in communication where if you ask people, gosh, what is the most challenging communication encounter that you've had in the last month? Feedback often is up there at the top of the list, right? People get really anxious about this, both when you're giving and when you're receiving feedback. And my hope today is that we take it from this confrontational space to more of a conversational space where we can both shine a light on what went well, what we should do more of, and those things that we need to work on continuing to improve so that we are the greatest health literacy organization that we can be, and our patients, our clients, and our members feel heard, and there's health equity in their ability to access care. So that brings us to ADAPT. Right? It's a tool to provide conversational feedback. I cannot take credit for this tool. This was created at the University of Washington, and it was originally established to provide feedback to medical trainees in a clinical environment and create a sort of quick, efficient, conversational way to provide feedback that takes less than 5 minutes. And there are lots of other ways that we can apply this to be efficient in our feedback and decrease feedback stress. So let's talk about it. It's a mnemonic. Anyone who knows me and serious illness communication work knows that there are about a bajillion mnemonics, so this is one of them. And this one is linear. It does follow this order. Okay? Ask, discuss, ask, plan together. Okay. And it follows a communication schema of ask, tell, ask, and how we talk about information with patients. And we add sort of a prepare step at the beginning to make sure we all have the same groundwork that we're starting with. And then the plan together piece so that we create a distinct follow-up plan for improvement. So we'll take each piece in turn. So first, we're going to prepare to adapt. This is our opportunity to reflect on what was the goal and the intent of the activity or the encounter. Right? Make sure we're on the same page. If there are expectations for, say, the outreach letter that's being sent out from your clinic, that it has to share certain information, this is the place to make sure that we're all aware of that, right? and then name that you're going to give some feedback. Okay. When I think about medical trainees, they often say that they don't know that they're getting feedback, and I know that we give them a lot of feedback, but we're not labeling it as that, right? So I encourage you, label that you're going to give feedback. Kind of put a signpost out. Hey, I want to give you some feedback. Let's spend a few minutes on some feedback. Is now an okay time to go over a little feedback, right? It feels cheesy, but trust me, right? It sets the stage and everybody knows what's gonna happen next, right? Okay. Now we get into adapt. The first A is ask, right? So we're gonna ask permission to give feedback. Then we're gonna ask their thoughts about the activity, getting their self-assessment. I wanna hear from them, how did it go, right? Ask what went well or what was effective about this thing, right? And then also ask them, gosh, what could have gone differently or what felt difficult? And then ask, are they open to your observations? Right? So when we're asking, we're gonna ask and ask and ask, right? There's a lot. We're digging deeper, we're getting more. And all the while, you are being an active listener. You're listening to their reflections, their self-assessment. You're reflecting back the things that you're hearing, right? And then you're gonna bring it back to the goals of the activity. So some examples, because I need words to use when I'm trying out something new. Right? So how do you think that went? How do you think things are going? What went well? Or what are you trying to work on? What didn't go as well as you were hoping? What would you like to try differently next time? Or what do you want feedback on? Putting the ball in their court. And now we're at D, the discuss. And this is where they get to share with you and you're discussing their self-assessment and you're using your observations to calibrate that self-assessment. I don't know about you, I am the type of person who always feels like I did a terrible job and will always nitpick all of the little details, right? And then in turn, there's other people who feel like they did an awesome job, even when you feel like, gosh, there are these other things they really could have worked on, right? And so all of our self-assessments need a little calibration, and this is your opportunity to do that. And we're gonna do this in a way where we are specific and we are descriptive, not evaluative, and we draw attention to behaviors. This is not about like who they are as a person, right? This is about the words that they used, the way the material was presented or not presented, right? It's not about the person, it's about the behavior or the activity. And sometimes we can think of a lot of things, and I'm just like we heard about chunking, we wanna chunk it to just like 2 or 3 items. Make it tangible, make it something that they're able to work with. And then we're gonna give both positive and corrective feedback. Now we're to our second ask. So then this is where we ask to clarify anything that's come up, to clarify what does the feedback mean to them, kind of probe for some agreement, like, does that resonate, right? Or is it totally off the mark from how you were evaluating the situation? And ask about opportunities that they might see for change and improvement. So some words we might use are, what are your thoughts about that? What questions do you have? What struck you as something you might want to focus on? And then that leads us to plan together, right? How do we get from point A, where we currently are, to point B, where we can apply all of these awesome skills from the Health Literacy Symposium, right? And how can you help them do that? Or are there other people that need to help and be involved? Right? So again, asking a lot of questions, right? This is a conversation. How might you work on X? Here are some suggestions that I see based on the work that I just did at the Health Literacy Symposium. And who or what might we need to help us make these changes? What might get in the way? Gosh, I was in a session earlier. We spent a lot of time talking about barriers, right? This is a great space to talk about that as you're planning for the future. Right? What's going to get in the way? All right. You all have this table in your packets. I believe it's page 15. And I'm going to encourage you to have it handy. Right? So this is prepare to adapt. We're going to ask, discuss, ask, and then plan together. Okay? So, I'm going to give us an opportunity to practice. So, for you all, for this to be most successful, you're going to have your packets, and you're going to find a buddy next to you. Ideally, groups of 2, but you could also do groups of 3. So kind of get cozy across the room. And we are going to go through 3 cases today. One is a research consent. The second one is an outreach letter. And the third are directions to clinic. So you'll observe the scene or the material, and then you're going to have an opportunity to think about, gosh, what do I want to give feedback on? What are the new skills that we can implement based on what I learned at the symposium? And then you and your partner are going to practice putting that into adapt and using some of these words to provide feedback that you can then take back to your colleagues, your supervisors, your workplace. Okay? Clear as mud? What questions do people have? All right, I'm going to invite up 2 of our special guests. So I'm going to ask that you observe the scenario where research consent is occurring. I want you to take notes on the things that you see go well, and then the things that you'd like to see improved. Okay? We are going to have Marissa join us as the patient, and Murph is our research assistant, and he's going to be consenting her for a clinical trial.
All right. Hi, Ms. Davis.
Hi.
So this study is a phase 1, open-label, dose escalation trial evaluating the safety, tolerability, and pharmacokinetics of the investigational compound TRX-147 in adults with solid tumors. Before we proceed, I want to ensure that you fully understand what you're consenting to.
Dose escalation, pharmaca something. That's a bit over my head. What exactly am I signing up for?
Great question, and thank you for asking. So dose escalation means that we'll start with a low dose of the study drug and gradually increase it in small groups of participants to find the safest dose. Pharmacokinetics is just how your body absorbs, distributes, and eliminates the drug. Basically how long it stays in your system.
Okay. And I thought I heard you say this hasn't been given to humans before?
That is correct. This is a first in human, so we don't fully know the side effect profile yet. Our main goal is to monitor safety, how well people tolerate the drug, and what kind of side effects, if any, occur. There may not be direct benefit to you, but your participation is crucial for moving forward with this research.
Sounds kind of risky.
It can be. That's why it's voluntary. You can withdraw at any time, no impact to your care. Would you like more time to think or talk with your family?
No, I think I get it now. I'll sign up.
Perfect. So I'm going to collect your signature now after you look over all these forms. You can have a copy of those, and then just let us know if you have any questions.
Okay.
Thanks. All right. Now I want you all to take 30 seconds and write down the things that you saw go well, and then the things that you might give feedback on. All right. So now you're going to turn to your neighbor and take those things that you wrote down along with your ADAPT framework and pretend that you're Noemi and you're giving feedback to Murph on this consent encounter. Okay, I'm going to give you all 4 minutes to talk through, and you'll have additional opportunities. So I would have one person give feedback, be the giver, and the other person be the receiver, and then we'll get to watch an exemplar. Okay? Questions about your task? No? Awesome. I'll be walking around. We'll give 4 minutes. All right, I may walk around, and I think we're doing okay on time. I talked really fast. We're doing good on time.
Yeah, we're good.
Yeah.
You didn't talk too fast,
Yeah.
but you kept it moving.
Yeah.
Leaves time for
Other good stuff. Okay, so I'm gonna shuttle around, and then I may be out there, highlight a couple things, and then we'll have you guys give feedback, and then we'll just make sure we're loud enough or close enough to this guy.
sounds good. I was like literally wondering what she does. Well, no, she, yeah, I think that she was excited about this whole symposium. She came last year too. In general.
I had no idea.
Yeah, I know. So did honestly, the biggest, for me, like the biggest thing that I knew already, but like after the summaries, especially in primary care, like especially like just like the system, you make me see like 12 people in the afternoon and all this stuff, like trying to like explain all these things, and then also put it on paper in like any sense, like just the time it takes. It's super important, but like, no, but it's like having like a script or someone, even like, because like you go to a dermatology office, like they do, and they know how to do it. It's like, just the ABS. I think for the teeth back part, it was tough for me, just for like the ABS.
I know, yeah. It was like, it's just useless. I used to type it out less Right. I mean, it's not, yeah.
I was doing the worst thing with ABSs in primary care, unless like it was like something very specific, like a print is on paper or something. Like,
I mean, this was, I had like a shell, and then I would fix it. I had this, that's a key, whatever. It's a message to our dermatologist. So, yeah. Wait, there's some most people, it's just like funny how like most people, a lot of people just without being used to
Excellent. I'm going to pull us back. I heard some amazing feedback happening around the room, highlighting some positive things, and a lot of feedback around jargon terms. Yeah. What questions bubbled up with you all as you started to engage with the ADAPT framework?
Like how do you address like really serious things like safety? Like for example, it can be, you can have serious life-altering risks.
Yeah. So the question was around how do you address the safety concerns, especially when our research assistant was pretty nonchalant of like, oh, it can be, right? Yeah. Great.
Like, what are some strategies to dig deeper when you ask someone how they think something went and they're just like, I thought it went great? Because that's probably what you would say.
We had a very confident research assistant. Yeah. Yeah. So I'm hearing wonders about like, what do you do when they don't have a similar self-assessment to what yours might be? Yeah. One more question. Yeah, right?
Got the signature.
Yep. Yeah. Right. So that information gives you data as the person who is giving feedback, right? It gives you data about where they're at and how directive you might need to be in your discussion, right? And I'd love for you to see at least an exemplar, and then we're going to have some additional opportunities to see about how we put this into action.
Hey, thanks for letting me observe today. How do you think it went, especially in terms of helping Ms. Davis understand the study and feel comfortable giving informed consent?
It went great. I used the form as a guide, and I tried to describe some of the jargon terms for them.
Yeah, I saw you did that. That was great. Is it okay if I share some feedback about what I saw?
Yes, please.
You responded positively when Ms. Davis showed signs of confusion and said, great question, thanks for asking. And then you simplified the language of dose escalation and pharmacokinetics in more common terms, and that builds trust. Looking back, is there anything you might have done differently?
Yeah, I probably could have avoided those big words just from the get-go.
Yeah, you could think about that next time. One thing I noticed, though, that there was a lot of information given at once and a lot of big words. And from a health literacy standpoint, it might help to talk about the study using more common terms, and then pause often, give a bit of info, and then check in before moving on.
That makes sense. I did kind of feel like I was rushing once they said they understood everything.
Right. That's a common moment to use a teach back. For example, you could say, just to make sure I explain that clearly, can you tell me how you might explain the study to your family tonight over dinner? That helps confirm their understanding without putting any pressure on them. How does that sound?
I like that. It kind of feels natural and conversational and patient-centered.
How does this feedback align with your experience consenting, Ms. Davis?
It makes a lot of sense. They really seemed overwhelmed, and I'm not sure they really understood every aspect of the trial now that I'm thinking about it.
Exactly. So for next time, let's plan to chunk sections, one idea at a time, and then use a quick teach back before giving them the form to sign. Maybe even highlight the key points of the consent document or have a bulleted summary sheet to take home.
Sounds doable.
Can you tell me what you might incorporate or do differently for next time?
Yeah, next time I'll define the jargon terms up front, and then I'll chunk the information so that I can make space for questions and for teach back. I already have a simple resource that clearly summarizes the trial in the bulleted format rather than just kind of handing them all the long forms. So I'll bring that along, and then let's see how it goes. I have another patient appointment tomorrow.
Great, thanks.
Round of applause. Excellent. All right. So one example of this at play, and we've got a couple other to keep practicing. So now you're going to observe or get to view an outreach letter. Again, as I look through this letter, I want you to take notes on kind of what things are being done well or are clear, and then what things we might give feedback from a health literacy perspective on making adjustments. So here is your letter. It's coming from the Community Health Primary Care Clinic, and it says, "Dear patient, as the seasons change and the weather gets cooler, we wish to notify you that influenza vaccines are currently being offered at our clinic for eligible individuals. Annual vaccination is widely encouraged due to its potential to lower symptom severity and contribute to broader communal health resilience. Options for receiving the vaccine include walk-in during business hours or by appointment. You can schedule your appointment via phone or web. Administration is performed by qualified personnel following applicable safety protocols. If you are uncertain about the relevance or personal suitability of receiving the vaccine, please reach out to our office for further clarification. Sincerely, Community Health Clinic Team." All right. I'm going to give you 30 seconds to take some notes, because this will be the last time that you get to see this lovely letter. I know, shucks. And then be able to provide some feedback on it. Here we go. All right, I hope you have some great ideas. Remember, our buckets are communication, resources, and patient-centeredness. I'm gonna refer you back to your ADAPT framework on page 15. I'm gonna give you 4 minutes again. Turn to your neighbor, this time a different person be the one delivering the feedback on this outreach letter. All right, I'll see you in 4 minutes. And I got asked for a point of clarification. You are a supervisor in a clinic giving feedback on the letter. I'm hearing some amazing discussions, lots of great places where this letter could be improved. I'm gonna pull us back. Awesome. So I'm gonna give us an opportunity to observe our ask, discuss, ask, plan together feedback framework in action. And today we've got Noemi, who is gonna be our staff person in the clinic, who is reviewing this draft with Marissa, her clinic supervisor.
Okay. Hey, Noemi, thanks for bringing your draft for review. I just attended the Health Literacy Symposium and wanted to give you some feedback so that we can improve communication and improve patient experience. Before I share what I learned and we get into feedback, how do you feel about the letter overall?
Well, I think the main message is clear. We're offering flu shots. I'm never sure if patients read these things when they show up in their mailbox, though.
That's a great observation. And you're right, the message is clear. I appreciate that you named the multiple options, like the walk-in and the appointment options. We're trying to make them accessible. And you just mentioned that you aren't sure that patients read them. Is there something that we can do to make it easier to take in?
Are you talking about like bullet points or bolding key information?
Exactly. The formatting of the layout can make it easier to read. We could use bullet points, larger font, and bold key information like the clinic hours and the phone number. I also wonder about simplifying some of the wording so that it's more clear and inviting.
I like those ideas. This also has me thinking about our patients who speak other languages. It'd be helpful to have this translated into other versions. We could send out the version that aligns with the patient's language preference listed in their demographics.
That's a great plan. Why don't you work on adjusting the language and formatting? In the meantime, I can connect you with the language services to create other versions. And we can review the revisions next week before we send them out.
Awesome. Thank you, ladies. And see, it can be quick, right? We don't have to spend a ton of time to provide quick and meaningful feedback that highlights both the things that are going well as the places where we can improve. All right, our last case for the day, this is directions to clinic. And I'm gonna paint a picture for you all, and you can take some notes on this to give feedback. As you are observing or listening to this, you're gonna be kind of the nurse for clinic, because this is me. So I was taking my son to his audiology appointment, and I got this MyChart message to give me directions to where to take him in Dorenbecker. And there's no provider listed. I wasn't sure what CDR Audio 1 meant. There was the date, there was the time, but then I was uncertain about the location. CDRC at DCH. I got a little bit confused, unclear if that was like the space I was supposed to go or not. And so I Googled and realized that that is within Dorenbecker. I need to go to the 7th floor. So we got all ready, we went, and then I get out of the elevator on the 7th floor, and it's like a hallway of lots and lots of different colors and lots of little booths. And I had no idea where I was going. And fortunately, everyone around campus is so lovely, and so I brought my phone with my MyChart message to some lovely person at one of the desks, and they directed me to the Purple Chipmunk down at the end of the hallway. So I found where I was going, and I thought, gosh, couldn't this be a little bit better? So I was talking to the nurse in the clinic and wondering, gosh, how could we make this better? So I'm gonna give you all 4 minutes in your group to pretend that you are the nurse in the clinic, giving feedback on how you might improve the directions that we send to patients and their families before their appointments. Okay, 4 minutes. I'm gonna pull us back for time. I heard some really great discussions. There's a lot of spaces and ways we could have taken this one to give feedback both on how we give directions and what the directions were themselves. I'm gonna pull our team up to show us one way we might give feedback in the ADAPT model with ask, discuss, ask, plan together.
Hi there. I had a patient and their mother come to clinic today and share how challenging it was to find our clinic. Are you available to talk through the instructions we send patients before their appointments? I went to the Health Literacy Symposium recently, and I have some ideas about how we can improve the MyChart message that we send.
I'm so glad you went to that symposium. I couldn't make it this year. Let's look through the message that we send to all the patients before their appointments.
What are your thoughts about the message? How do you think a patient who has never been to OHSU or Dornbecker might feel?
Well, the essential information is there. I didn't realize it put the abbreviations in there. That is confusing. I can already tell we can improve it by writing out the full names of Dornbecker for DCH.
I think that's a great place to start. The mom also shared that she wasn't sure where to park, which elevator to take, and when she got to the 7th floor, which animal to go to.
It's very generic. I know sometimes the scheduling staff will share, when you get off the elevator at the 7th floor, go to the purple section and look for the chipmunk in order to find our clinic.
I often use those same visuals when I'm describing where our clinic is. Great idea to include it in the message, though. Since it's in their MyChart, could we also put a link to a map of the campus with the parking options? What questions do you have?
Those seem like reasonable changes. I think it'll make it more clear. I'll work on those modifications, and then let's review it again before implementing the change.
All right, a final round of applause for my amazing colleagues for their assistance today. All right, so in our last, tiny bit of time, I'm gonna ask us to just shift gears for a minute. You all have learned a lot today, right? And we've asked you to engage with this material a lot. So let's just take a minute to do a little reflection. You all have paper and pens, or maybe send yourself a virtual note or text message. Kind of from this session and your entire day-to-day, what surprised you? What are you gonna take away? And what are you like, Bree, Cliff, and team, like, I'm not entirely sure about that. Well, give us a minute. All right. Anyone who's willing to just jump off and share a reflection, I'd love to hear that before I hand it over to Cliff for the closing. Yeah.
My background is physician, and I think my instinct is to want to make it perfect. Just like you want to simplify messaging for patients, I feel like my takeaway is give less information than you want.
I love that. The takeaway of giving less information in your feedback. Yeah. Kind of boiling it down. Yeah. And behind. There was one more. Yeah.
What she's consented to, how do you go back and fix those
Yeah, great. Thanks for sharing that, which was the power of the teach back, right? Building it into a lot of different environments, even non-clinical. And then, gosh, what do you do to go back to a mistake after it's happened? And I think, building this culture and space where we can talk about things when they don't go as well, hopefully empowers us and our teams and our colleagues to readdress and create additional touch points for, say, that patient. Yeah. I appreciate all of you and the hard work that you've done today. So thank you, and a special thanks to my colleagues who helped out today, and then to many of the co-presenters who tolerated my emails and meetings to better understand how to make this feel meaningful. So thank you.
Right, we made it through the day. I don't know about you, but I'm feeling very inspired and pretty tired. But I have one more round of applause for Marianne Abrams and a wonderful presentation, and all of our amazing speakers. I've got so much to think about and so much to take away and ponder to your last point there. What am I leaving with? Before I forget, a set of keys were turned in. If you lost a set of keys with a surfboard on it.
I just found them this morning.
Come on in. I don't have any parting gifts, but I'll give you these. All right, I'm gonna do. I need to get out of this and see if I can pull up one slide here real quick. Let's see if. One moment. Okay, we're at this point right here, but let's stay there for a second. All right. So, we're on this journey to becoming a health literate organization, right? And just to leave us with that, what that is in our heads. What are we talking about here? OHSU as a health literate organization is going to be a place where we present complicated and not complicated health information in all its forms in the most easy to understand way that we can every time with every person, with every patient, with every family, with every caregiver, with every research participant. And we do this as our kind of our always events, right? Where we do this as this universal precautions approach. We assume that every one of us is going to have questions and concerns about this information and have some uncertainty. So we're going to try to make it as easy to understand as possible. Part of that is an exercise in empathy, putting ourselves in that other person's mind and where they're at, right? And anticipating that they may be feeling stress. The other piece to that is not only do we as an organization need to do that for our patients and our research participants, we also have to use that to teach the next generation, right? We're an educational institution. And so for us to do this across these three mission areas, it's going to take every single one of us, right? All of you now, having spent this time here today, are going to be ambassadors for this kind of change. And one of the really important tools that we've just heard about is how to provide feedback and how to help us spread all the amazing things that we've been thinking about and talking about here today, which isn't going to be that easy. So I'm really glad that we've learned some of these tools that we can now go out and start to practice. Some of the things that I would recommend and suggest would be, as first steps, would be to go into your work group, the people that you work most closely with, and see if anybody's interested in forming a health literacy committee or a health literacy group. And we've seen that work very successfully in our IRB, for example. We have representatives here today who can tell us all about that. Over at the Richmond Clinic, we've had a very well-established, long-standing health literacy work group. It's fun and it does really meaningful work. So that would be my sort of one suggestion or recommendation. And give feedback, right? We've learned some ways to do that today. But I'd also love to just hear, we have a few minutes, I would love to hear anyone else's sort of takeaways or kind of what your maybe next steps. If there's anybody who's willing to share something that they've picked up here today that they think they'd like to take out into their work group or their work area. Corey.
I plan on, and I'll reach out to Bree after this, but connecting her with Cassie at one of our trainers who has a feedback model that we use in the SP program, and just so you can share those and maybe work towards synergy in the process.
So.
And then I have, we work together on our poster and just being here and yesterday and talking to different learners who I don't often get to out of the lab and the stressing the importance of teach back obviously was our like I think in the so far we've seen like good improvement on that, but also just like also seeing how important that is and thinking about how we can apply that in real life plus in the workforce, but then I'll be thinking about how to personally take that back to the center and model it in ways that it becomes a habit with us as well.
Thank you. I love that. So that's getting it, really infusing it into that educational branch of our mission. Love that. Yeah. Anybody else willing to share? Yeah.
Yeah, I think one of my big takeaways is that it doesn't necessarily require like a full overhaul of every document that we have, every interaction, everything that we do. It can be as simple as like changing the way I ask if a participant asks questions to, pivoting to more of a teach back, pushing them to ask me their questions and opening that up. It doesn't have to, we don't have to start from scratch with everything. Just these small tweaks in the interactions going forward.
Yeah, I really appreciate that. I think someone mentioned it earlier. We don't have to be perfect, right? Just and if we wait to have everything be totally perfect, we're never going to get started. And so getting started in those small, doable steps now makes a lot of sense. And we're all starting to do those little things. That's how you do culture change within an organization.
Yeah, so many of the bigger things feel out of our control. So I can't recreate all of the documents we use,
Uh-huh.
but I can change the way I explain them. Just start very small, very personal.
I love that. Yep. And then some of those bigger things, the health literacy work group, that's the level we're trying to work on. But we need the sort of the ground level, every day-to-day little moments to be sort of elevating that. Love it. Yeah. Who else? Yeah, in the back.
The concept that health literacy is fundamentally about changing historical power imbalances. Like it's all really linked to power, and that's why we're doing it. It's not just because we're being nice. Like actually trying to correct systemic.
Thank you for that. That'll be our final comment, and that is an awesome one to end on. It's 5. Please fill out the evaluations, and if you brought a poster, if you could come get it before you leave and take it down, that would be very helpful to our planning committee. Thank you so much. I'll have a really great rest of your afternoon, evening.